So in terms of my educational background, I'm a registered nurse. Following high school, I went into the undergraduate nursing program here at Ryerson University and did a 4-year undergraduate degree. After that, I went out into practice as a registered nurse for 10 years and then decided to go back and do my graduate education. So I came back to Toronto and went to the University of Toronto to complete my Master's of Nursing. During my Master's of Nursing, I got really interested in research, so I decided to apply for a PhD. So I applied again to the University of Toronto to do my PhD and finished that in 2009. Technology really has been emerging in healthcare for centuries. And there's positive, there's negative effects of it, of course. We have all sorts of technologies now, from a CAT scan to a PET scan, even an X-ray, which shows you a little vision of what's going on inside the body. So these are great things for patients because we can find out what's going on with them and what's going on with them faster. So it's really important as you're being any practitioner, whether it's a nurse, a physician, a physiotherapist, an occupational therapist, that as you're using technology, and it could be something as simple as a stethoscope, to be chatting with the patient. So I combine both science and art. It's something that's quite novel in healthcare. There's not a lot of artists and scientists that combine the two. With the 7,024th patient, this is an art installation, and it's a research-derived art installation, meaning that I conducted a research study about patients' experiences of open heart surgery and recovery. And one of the main research findings from that study was the importance of humanistic healthcare approaches. And when I say humanistic healthcare approaches, what I mean is what does it mean to be ill? What does it mean to be human? What's it like to undergo heart surgery? What do patients feel? What do they want from practitioners? How do they want to be treated as a human being with unique needs? So I decided to create an art installation. So from there I created a multidisciplinary team that included myself as a nurse, a cardiovascular surgeon from one of the hospitals here in Toronto, a social scientist from the School of Disability Studies, and a scientist from the School of Fashion here at Ryerson University, as well as a design strategist whose expertise is designing installations. So the art installation in the end was 1,700, it was large scale, it was 1,700 square feet. It was designed like a labyrinth. So in fact, as the viewer, you would walk into the installation and it starts in the zone that's attached with the preoperative period. You would walk in, view images and poetry, and you would wind your way deep inside the operating room, or metaphorically deep inside oneself as the patient, or oneself as the practitioner, to reflect on what's going on. And then the design, again the labyrinth design, winds yourself back out into the post-operative period and home, and you return to essentially the same place, but something that's new now that you've reflected on this intimate experience of patients' encounters of heart surgery and recovery. Nursing is both an art and a science. So yes, we deal with science. You know, we need to learn about the biology. We need to learn about biology and chemistry and how the body works, how blood components, the heart, the lungs, oxygen, sodium, potassium, all those things that make the heart work and the rest of the body as well. But that's one component. There's also an art to nursing, so which I would say is just as important as the science piece. And that's how we've got to remember we're dealing with people. We're not just dealing with technology, we're dealing with people that are undergoing, some sort of potentially transformation, some sort of illness. And we need to know how to interact with people, how to frame questions in order to get answers from patients. It's really important as a practitioner to listen to patients, listen what they say, but listen what they don't say as well.